Hi, I'm Erica Petrini, and I am delighted to welcome you to Access Health. On today's Access Health, we're talking about the connection between brain and body and how you can take action to prevent negative, toxic thoughts and emotions from creating some serious health problems in your life. Our expert team and my good friends are here to help us flesh out this story. Let's welcome Dr. Dennis Holmes, a renowned cancer researcher and surgeon, our fabulous nutritional expert, Janet Zapala, and our amazing fitness expert, Dave Sinclair. Well, what a gorgeous group I have with me.
Oh, look who's talking.
So we've got such a good show ahead of us today.
Yes, a lot of good information to share.
And so very important.
Yeah. So should we get right to it?
Let's do it.
Let's do it. We've actually got more information on our website. We also have got some great suggestions on the website about how to recognize and identify negative thoughts and emotions and how to be aware of the impacts they have on our bodies. Now tell us what's on your mind. What are some of the ways that you deal with mind over matter in your daily life? Next on Access Health, have you given much thought about brushing your teeth today? I bet you haven't. Well, you might when we tell you the shocking results of not doing it.
Ooh.
Stay with us.
Did you brush your teeth today?
I did.
We've all heard that oral health and whole body wellness are connected, but new research tells us that people with poor dental health tend to have more general health problems, not surprising. Well, with us today, Michelle Strange, dental hygienist, is here with us. Thank you so much for joining us.
Absolutely.
Welcome, Michelle.
Thank you.
Have to tell you that I've brushed my teeth a few times, did a little flossing. I get really nervous in front of dental hygienists. I don't know what it is.
Well, it's okay. We look, but we do not judge, I promise.
Good to know. Okay, so I have to ask you, what, in your opinion, are the main causes of poor dental health? And do you think there's this mind-body connection?
I think there's a slight bit of a mind-body connection. If you're a real anxious person or you suffer from anxiety, you can grind your teeth a little bit more. If you're suffering from depression, you probably aren't taking good care of your whole body, including your oral health. But I think that's just the tip of the iceberg, really, because there's such a correlation these days with studies showing us that systemic health and poor oral health are so linked. So it is just the tip of the iceberg.
And I know we've all heard the saying, the eyes are a window to the soul, but so are the teeth and gums.
Oh, yes.
Because the appearance of the teeth and gums not only tells us about how we take care of them in ourselves, but also they may reveal an underlying health condition, both physical or mental.
Talk to me a little bit about these general health conditions.
Well, there's a large body of data linking periodontal disease or disease of the teeth and gums and bone with other health conditions such as heart disease, diabetes, even cancer.
Yes.
The link is that bacteria that live in the mouth and that may cause inflammation there may also spread to other parts of the body and cause problems as well.
Wow.
And it's also, whatever is occurring in the body can affect the mouth, because if you're taking certain medications for some of these systemic diseases, they can give you dry mouth, which is known as xerostomia, which can increase your decay rate. If you suffer from acid reflux, you can actually increase your amount of cavities in your mouth because of all the acid.
So what I'm hearing from you is that really taking care of our teeth is more than just having a pretty smile.
There's also this issue of inflammation. Inflammation in the mouth can stimulate inflammation in other parts of the body, and that's important because inflammation is one of the causes of cancer.
Inflammation begins in between the teeth, and it is what destroys the bone, which the teeth sit in, so we have to control it.
So can you tell us, Michelle, what would you recommend as a daily dental routine?
Well, brushing first and foremost, and doing it for at least 2 minutes. None of this quick little 30 seconds in and out, and we go about our day. Brushing is where we start, but really and truly, it's only going to clean about 60% of our teeth. We really have to remember that we have to get in between our teeth because that is where the inflammation starts.
What about flossing?
Flossing, it's difficult. I mean, not everybody can do it, and some people, they use floss, no problems, but other people have larger spaces in between their teeth, and then that's where this line by Peri comes in.
And I just want to stop you for one moment, because going back to the brushing and the toothbrushes, I see you have them here. I don't think I'm the only one that gets overwhelmed when I have to buy a toothbrush. There's so many. Is it an individual thing, or is there general recommendations?
Well, just overall, you want to make sure you have a soft bristle. Gone are the days of a hard or medium bristle, because then you start to brush too hard. We also want to make sure we don't have that.
I think that's my problem. One of my problems.
Well, and people like to do this like white knuckle grip on the
it's so
brush.
true.
I mean, we just want a light pressure, but the bristles, they're the main function. And you want a nice little tapered bristle, and you want to be able to hold it well, which is what is so great about this Peri brush here. You can really grab it.
This one is so incredibly soft.
So is this one.
It is. It
Not
is.
for everyone, though.
No, and there's some that are made for after surgery, but your everyday brush should just be a soft bristled
And the
brush.
teeth are so fine at the end.
Beautiful.
Yes.
Absolutely.
Really get
Yes.
in it.
Yeah.
Exactly.
Okay, so now we've dealt with the outside, but really the more important part is what happens in
between the teeth.
and it's so hard to access. Yes, there's flossing, but there's more.
There's definitely more. It's very hard to, as a hygienist, to say everyone brush and floss. Because one, you might not be able to hold the floss, you might not have very good fine motor skills to get your hands in the way back. Plus you might also have larger spaces in between your teeth, and you need a little something extra when you get into those larger spaces. So that's why this line by Peri, it comes in all different sizes, and they're nice and pretty, but they're not just beautiful colors. The colors actually mean something. They're sized. So it's not one size fits all. So you can't just go to the store and grab your little tiny brush and think that that's going to fit everywhere.
What does a different length mean? I'm interested in knowing that.
Sometimes it's just for dexterity. You have this side where you can grab it. It comes with a cap. You can put it on the back. It actually lengthens the handle a little bit. This, if you need to grab it, like we have dexterity issues as we age with arthritis and things like that.
But these are called interdental brushes, the
yes.
Peri interdental brushes.
Correct.
Absolutely fabulous, and really I've used them. We were all sort of trying to grab them after lunch.
I feel like I need to take a dental break now.
This one feels about right for me, but there's a big one over there.
There's a big one there. And everybody's a little afraid of this big one. But you know, sometimes we lose a natural tooth and we have a large gap. This fits perfectly in that area.
Okay.
So this is why I was saying it's just not one size fits all, because we all have certain parts of our mouth that we have a space here, we have a missing tooth there, maybe have a little crowding in the front.
So can we use these for braces, bridges, and dental implants as well?
These actually make lives so much easier around those certain dental appliances. But the great thing about this line is that they are plastic coated, the wire is, so you can use them around implants without harming the titanium implant. And the thing a lot of people forget about implants is they can fail. They can have disease around them. They will never decay, which is great, but you can have bone disease and gum disease, also known as Peri-implantitis, and they can fail, and you can lose that very costly implant.
Proper cleaning.
Yes.
Okay. And when do I know that I have a real issue, though, doctor?
Well, if someone is having persistent bleeding that doesn't recover after a few days of proper care, I think they should consider maybe that there's another problem. And sometimes there's a link, as we've said so far, between dental disease and other conditions. For example, did you know that poor dental health is as strong a predictor of heart disease as your cholesterol level?
Well, we're going to try to prevent any of that by doing the right thing. I've got my tool, my two new tools.
Please, for your hygienist
for you. That's for you. Thank you so much, doctor, of course, and thank you, Michelle, for joining us.
Absolutely.
You'll find much more information about Peri Interdental Brush on our website, accesshealth.tv. So keep up the good attitude and go brush up that smile, please. Now, earlier on the show, we talked a bit about how our moods can affect our eating habits. But what if what we eat changes our brain chemistry? It's kind of a catch-22, right? Yeah, I know. But we'll tell you how to break out of that dangerous spiral in just a moment. Well, welcome back. We've talked a lot about how our mental and emotional states can directly cause health problems. Let's turn the tables a bit now and talk about how our body conditions, specifically whether we're getting the right nutrition every day, can help resolve psychiatric problems. With us today is David Hardy, founder of Hardy Nutritionals, and we're rejoined, of course, by Janet Zappala, our nutritional expert.
Good to be here.
David, I'm so glad that you're here. You've developed a nutritional formulation that has been studied extensively in the treatment of mood disorders.
That's right.
So tell us, What is the scope of the problem?
It's a huge problem. Harvard University statistics say that in any given year, 1 in 4 in the population will have a diagnosable mental illness.
And I think that women especially tend to suffer the most.
Absolutely.
Because they suffer in silence. They don't want to be a burden to their family and friends.
Speaking of family, you actually have some personal experience with mental illness in your own family. Can you tell us a little bit about that story?
I do. Several years after we started studying this, and I was working with hundreds of other people with mental illness, and so I began to understand more about the illness itself. Ironically, I came home one day and my son was completely psychotic. He'd had a psychotic break and was diagnosed with schizophrenia. And about a year after that experience, my daughter was diagnosed after the birth of a baby with postpartum psychosis, which is a little more rare than depression, but still there. And those experiences were devastating. I mean, my experience with other people with mental illness is one thing, but it doesn't hold a candle to when you experience with someone that you love.
Your kids.
So David, was there any sort of silver lining?
The biggest thing that came out of it was an incredible desire to legitimize this so that my grandchildren and your grandchildren and millions of others don't have to go through what my family went through. That kind of motivation probably would not have come had I not had that powerfully emotional experience with my own children.
It seems that people who suffer with mental health problems may be nutrient deficient when it comes to what they're eating daily.
There is mounting scientific evidence proving that minerals and vitamins indeed can have a powerful treatment effect on mental illness.
Very powerful. And as an example of that now, we're going to hear from Dr. Charles Popper, a clinical psychiatrist and long-term instructor at Harvard Medical School, who has used David's specialized formulas in his practice.
I first became involved in nutrition as a psychiatrist, observing a 10-year-old boy who had bipolar disorder, a very serious form of it. He was having major temper tantrums for an hour, 2 hours, 4 hours a day, every day for some months. He took a vitamin mineral supplement, and within 5 days, his symptoms cleared entirely. The tantrums were gone on the 5th day of treatment, and he wasn't even irritable. He wasn't even grouchy. Now, we don't have any psychiatric drugs that can do that. I've never seen a psychiatric drug do that in any case. So, based on that one child, I began to pay attention to nutrition and to the use of vitamins and minerals in particular to treat mood disorders.
We don't always see that quick of a response with the supplement, but it was a great way to introduce Dr. Popper to nutrition because nutrition was not on his radar screen at all.
Now, it's just not any ordinary supplement that has this sort of effect. I know when I go into a drugstore or a nutritional center, I'm overwhelmed. I have no idea what combination, which form. I mean, it's just complicated.
When you choose a supplement that's not complete, when you choose one that's not properly balanced, when you choose one that's not very bioavailable, you don't get a very good response. We've found what the right amount is. We've also found a special way to put together our products so that the minerals become more effective, and it's very significant. The minerals we process in a way that combines the inorganic molecule with organic molecules so that it makes it into an organic molecule that is, in some cases, 100 times or more soluble than the inorganic form.
This is pretty important, and we're going to let Dr. Popper weigh in on this one.
Especially in psychiatry, when we're using these as medical treatments, we look for very much higher quality vitamins and minerals that are demonstrated to have much higher absorption rates than the routine commercial formulations.
The power of absorption. What we eat, we have to absorb in order to get those necessary nutrients. I could not agree more with Dr. Popper on this one.
Our research speaks for itself.
Right.
There are over 23 medical journal publishings from 15 universities, 4 different countries. Our supplement is the most studied supplement for mood disorders on earth. We're excited about the research and the verification that it gives what we do.
It is so exciting, David. And Dr. Popper is another prominent example who believes very much in this research. Let's take a look.
If it turns out with more effective studies that we can treat depression, bipolar disorder, attention deficit disorder, perhaps other psychiatric disorders, with vitamins and minerals that were as effective as the current psychiatric drugs, but with much fewer side effects and better long-term stability, and with less mental fog. If that were to turn out to be true, then we would have a much better set of alternative treatments to be able to offer patients who are currently struggling with these conditions.
So Dr. Popper clearly agrees that the use of specific combinations of vitamins and minerals can have a big impact in the way that people practice psychiatry.
When you understand how minerals and vitamins work in the body, that they're the basis of every metabolic process, they become not only the most logical, but also the most likely cause of all kinds of illness. So research does show that they positively impact and reduce the level of cancer and heart disease and Alzheimer's and many other chronic illnesses that we suffer from.
Why can't I get that from food? Why do I need a supplement?
It's just not in the food anymore.
So the best approach to good health, of course, is always prevention, preventing illness. Using a complete nutritional supplement, I think, is a solid step in the right direction.
David, thank you so much for being here. A wealth of knowledge. And Jenna, thank you as always.
Pleasure.
And wow, what a depth of experience Dr. Popper brought to this discussion. Now Dave Sinclair is up next, and he's going to show us why you're out of excuses to not start that new fitness routine today. Welcome back to Access Health.
Hey Erica, you've heard the expression, a body in motion stays in motion?
I have heard that. You know what my philosophy is? When it's gorgeous outside and I see my kids sitting on the couch, it drives me insane. I get them outside and playing sports.
And you know, a lot of times for people, it's that first step that's kind of mental, which is why it's great that we have Jonathan Sarmiento here, and he's from Sports Authority. And what Jonathan's going to do is he's going to take all those excuses that people have, he's going to whittle them down to zero. Right, Jonathan?
Yes, sir.
I like to try a bunch of different exercises to see what I'm comfortable with. Do you suggest that people do that?
Absolutely. It's important to have choices and keep variety in mind. Whether you're starting a new fitness routine, you need the gear, and you need to have the right attire. This will help make sure that your experience is a positive one.
You've brought some stuff that's really like cutting edge technology. Tell us about what you've got. This is really interesting.
I have one thing in particular that I would recommend to just about anyone. It's a fitness monitor. This one in particular here is our Fitbit Flex. This will count your steps throughout the day, your caloric intake, and will also monitor your sleep patterns.
Cool.
Wow.
Can I take a look here?
Absolutely.
I love that. And sleep is so important. People kind of underestimate that.
Definitely.
What I love about this too is that you can upload this to your cell phone or your computer. Right, Jonathan?
Absolutely. You could even share with friends for friendly competition. This one in particular here is the Polar Loop. Also comes with a guide to help you reach your goals. And if you'd also like to use it for swimming, it's perfect for that.
Jonathan, tell us about some of the family sports options at Sports Authority, because you've got a lot of those.
It could be anything from football in the backyard, basketball, soccer, or even racket sports at your local park. These are all very good, inexpensive ideas to get everyone involved.
You know what I think about when you rattle off those long list of sports? All of the many outfits I will need.
Bottom line, whatever it takes to get healthier, it's all good.
Well, thank you.
It's not just about style, it's also about functionality.
Right.
So whether it's winter or fall, I would definitely take a look at our Under Armour line of lightweight, breathable technology. This will definitely help you out if you're running around and it's a very cold day. If you layer correctly, it will definitely help you out.
So got the workout outfits.
Talk to my husband about that one.
Well, you know what else is important is sports-specific shoes. That's really important in the prevention of injury. But also, and something some people might not think about that you really have covered with something cool, is hydration.
We definitely have a solution for everyone. It's called the Camel Pack. Whether it's biking or cycling, it's a great option because it's comfortable and light. At the same time, you could pack a rain jacket in it, and it also holds 100 ounces of water.
Another thing I like to cover is yoga.
Absolutely, it's very important. Stretching and yoga will help you maintain your flexibility, whether it's in a class setting or just any video that you may pop in the morning.
Fun equals consistency, consistency equals results. And Jonathan, we appreciate you coming in, and thank you for eliminating all of those excuses. Nobody has any more excuses.
And you help make it fun.
Thank you for
That's
having
what
me.
Sports Authority does.
Thank you.
Thank you so much, Jonathan. And thanks for being with us today to talk about mind over matter when what matters is your health and well-being. I'm Erica Vetrini, and on behalf of Dr. Dennis Holmes, Janet Zapala, Dave Sinclair, we look forward to seeing you next time on Access Health.
I access health by playing tennis 6 hours a week.
I access health by making sure I eat my greens every single day.
I access health by doing a daily stretching routine. It's quick, it's efficient.
I access health by going dancing with my fellow mom friends on a really good mom's night out. Tell us your stories. How do you access health?